You're also expanding your operations here in Plattsburgh.
We are. We had been out of space for a long time and have had wait lists to get people into our clinic for assessments and treatment. And in July of last year, we bought the building that we're currently in. And I would say that renovation of our current building is going to be starting probably within the next 2 weeks on the other side. And our entire clinic operation will expand, and we will get that wait list to 0. We're going to have more medical staff on board, and we will be able to provide what's called ancillary withdrawal services out of the outpatient clinic.
And this is necessary because, as you mentioned, you've seen a 50% increase over the past 5 or 6 years. You've got to expand and address this.
That's right. Yep.
And the hospital, Dr. Hall, does the hospital on an almost daily basis see the effectiveness of people coming in that need help?
Oh yes, and especially coming through the emergency department where we see this, as you said before, on a daily basis of patients that are either looking for help or are overdosing or suffering the effects of the opioid crisis. And in addition to what is being done in the Alliance for Positive Health, the emergency department at CVPH has also started to give Narcan to patients that come in and would be appropriate, and then they're referred to Alliance for Positive Health for their follow-up.
Up to this point, you evaluate a patient. You can recommend and even make calls on their behalf to get them into a detox unit, but again, at this point, you're either shipping them to Canton, Potsdam, or down to the Albany area.
Correct, and to what Connie was just saying, we will make the phone call. But we're very lucky if there's something available for them, and then we have to say, well, here's the phone number, you can be discharged, and then you can follow up, and what's the likelihood of that being successful? I don't think anybody knows because we just don't keep those kinds of statistics, but the reality is that it's probably pretty low.
The hope is there may be beds now available here locally.
Correct.
And your hope is that you will be able to handle with the 16 that you will be able to take them, but there may be times where they may not be able to get in. Do you anticipate that this will fill up quickly?
Well, I do believe it will. We've done a lot of work with CVPH. I assume that they're going to be a solid referral. The outpatient clinics in this community can be a solid referral. Families. That's another huge change that we've seen at our outpatient clinic. Historically, key referrals for people into our agency have come from other providers, whether it's the hospital or a rehab or a detox, and then some sort of legal involvement, probation, or one of the legal entities. This year, for the first year, the key referral for folks into our agencies has been families or self-referrals. And that's been a startling change at our agency, and one that we're so happy to see happen. So we're seeing the earlier intervention. And with CVPH, about 2 years ago now, Senator Little had worked with the hospital and with Champlain Valley Family Center. She's an ardent supporter of getting the services to where the individuals are, and she has helped us establish a beeper program with CVPH. So when we get beeped, we guarantee that we'll have somebody in that emergency department within an hour to go in and meet with the client, as long as they sign a release and they're willing to meet with us, to do some pretty thorough screening and referral, so that when they're coming out of the emergency department, we work to have an appointment scheduled at one of the facilities in Clinton County.
And that intervention is critical, desperately needed.
Yep.
We've seen, you see it in your emergency room. We saw it in the documentary, Chasing the Dragon. So many times heroin addicts will come in near death or be brought back from death in the emergency room, and only to, within a short time, be released and head right back out and be using the heroin again.
Right, exactly right.
In fact, we heard in the documentary, I think there was one addict in particular, who that may have happened 3 or 4 times in a day,
Yeah.
which sounds unbelievable, but that's what you're up against, and that these intervention coaches
Yep.
coming in to provide that counseling could be critical.
Yep. Providing the service wherever the individual is at, whether that's at the jail or whether it's at the hospital. If the client is willing, that's when you want to be with them, and that's when you want to engage them.
The night of the event, we heard from Jason, who was a recovering addict, talking about his struggles with first opioids and then heroin. We also heard from a mother and daughter, from Francine Cornell and her daughter Amber Lynn McConey, who lost a son and brother. He had been making progress. He was at a halfway house in the Schenectady area, and he overdosed last summer. And they really put a family's face on it about what the struggle that they went through for many years and what they've been through. They are now behind an effort to help families by having a get-together twice every month at the hospital to really help families cope, to bring them together.
Yeah, their support group is Never Lose Hope, Learn to Cope, and they're on the 1st and 3rd, I believe, Wednesdays of the month. And I think, Francine and Amber Lynn are kind of the forgotten casualty of this epidemic, but it's all too common, and what we've heard not only from Chasing the Dragon, but even in the schools is that families are watching this, watching their loved one be addicted and need help and trying to help in whatever way they can, and they're sort of ill-prepared, or they don't really know what to do. Another kind of forgotten or hidden casualty of this is grandparents, aunts, uncles raising children of individuals who are addicted and either in jail or in rehab or caught up in a family court system. And so, those people need somewhere to go. They need, and Amber Lynn and Francine have been instrumental in trying to get a support group for those families, because nobody really knows what they're going through we do anecdotally as professionals, but the real emotion of it, they need a place to go, and Amber Lynn and Francine have been, really pioneering that effort.
And we've heard this in the past couple of years. This is really putting pressure on families. Absolutely. And the need for foster families to take these children from homes where either one or both parents are addicts, and to be able to step in.
Yeah, this epidemic hasn't wavered. We are around 50% of the children in foster care, 50% of the petitions that we file regarding neglect are as a result of substance abuse, whether it be opioids, heroin, polysubstance abuse, alcoholism, and those are just the ones we file. There are a lot of informal caretakers in this community that don't ever rise to the level of being in the court system, that are taking care of children while individuals are going to rehab or while they're being jailed, and it's truly a big burden on the social services system.
One other thing that Amber Lynn brought up, and a point I know you were trying to make during the event at the Strand that night, she really encouraged people to go to their medicine cabinets, clear out all the old prescriptions, the opioids, everything that's an old prescription that's not being used, and dispose of them responsibly. Yes. Not down the toilet, that's not how to get rid of them, but the police chief in Plattsburgh mentioned that they now have an around-the-clock drop-off for unwanted prescription drugs. We see that pharmacies are offering days. I think there's one coming up at the end of the month at Kinney Drugs. They're offering opportunities for people to get this out of their cabinets so that it's not there. It's not there for the kids, grandkids. It's not there for people who may be breaking into homes looking for it. It's really a good idea to get rid of them.
Absolutely.
Absolutely.
Yeah.
Is more needed as far as a permanent drop-off? Does the hospital have a permanent drop-off, or should there be more permanent drop-offs around to make it even easier? And is that something that's being discussed?
There are a few areas, it's not only the Plattsburgh City Police Department, but the Sheriff's Department also has a medication drop-off. The Alliance for Positive Health, on their website, they list the drop-off areas available. But certainly, the ease of getting rid of that is helpful. If somebody has those prescriptions available, I think people are reluctant to carry them around to find a drop box. There is the prescription drug take-back day that the DEA does, and that's April 29th from 10 to 2, and there's various locations in the community. But, we could always use secure places. There are some regulations around that. Obviously, it has to be monitored and things like that. So that's where the difficulty comes in on, having it at like a substance
Right.
abuse facility or a
Right.
hospital. That's why police office, any sort of police department is a good place because they're usually manned and secure.
And we know Dr. Halder's constantly training for physicians that to try to help them with the prescribing and the overprescribing of opioids.
Right. So just as we have to educate the population, I would say that physicians are part of the population, and we need to, and we do on a regular basis, educate them also about what is appropriate prescribing, how much, does a patient really need an opiate given the type of pain that they're having? Is an opiate really the best pain medication for them? Does it even help in certain circumstances? And those are all things that we have as ongoing educational experiences. The state is stepping forward with regulations about appropriate prescribing, not only in terms of what you have to do, are you giving the right number for the condition that the patient has, but also are you evaluating what prescriptions a patient may have recently had to make sure that you're not doubling up on something.
that they can't
and those
doctor
are all
shop
very,
and-
very helpful. Yes.
Yes.